Both Teri and I could go on quite a while talking about what seems to be miraculous occurrences in healing with people that have talked about their symptoms for years, but engaging the parts of the brain that hit where the trauma lies and releases it, produces immediate shifts that are quite visible and certainly felt by the client. Anxiety is characterized by a diffuse fear that somatically is measured by a generalized constriction in the musculature, especially around the breathing system. Fear generated by not being able to breathe is some of the most intense and immediate fears wired in the human organism. So a generalized tension around the breathing mechanism signals danger to the brainstem and cannot be directly suppressible by higher cortical functioning. In other words, we can't just talk ourselves out of it. We know that underlying anxiety is often a precipitating factor in turning to substances, legal or illegal, for relief. It's been estimated that 60% of hospital transports in the United States have to do with some breathing difficulty. Depression presents another face of breathing deregulation and is characterized by overly suppressed breathing for an extended period, leading to an altered brain chemistry, which keeps the system in a different form of emergency shutdown. Adroit use of faster than normal breathing, physiological reframing, and eventually slower than normal maintenance breathing can reduce the recovery time significantly with anxiety and depression, and avert the dependency on pharmacological intervention to bring the system back to healthy self-regulation and enhance growth. The benefits of faster than normal breathing in trauma and addictions recovery. When correctly modulated, that is, the faster than normal breathing doesn't just mean you breathe fast. You have to be trained to take an active inhale and relax on the exhale. And this is where a great fear of faster than normal breathing has come up in the clinical world. They think we're teaching people to hyperventilate. Absolutely incorrect. We're teaching people to superventilate. In other words, to take more oxygen into their system without going into tetany or hyperventilation. The key is knowing how to relax on the exhale. This can be trained, is trained. I've been doing it since the 1970s. People do not come out of sessions hyperventilating. The client learns self-regulating using breath modulation when potentially re-traumatizing stimulation occurs or when they're activated. With sufficient training, the technique can be used just on a daily basis to recalibrate their body and mind, increasing self-confidence and opening to new potential. So what are the cautions of this? Well, the client must have the cognitive capacity and maturity to understand the process and what the technique offers to them, because they are in charge of it. We're just the coach. We're teaching them how to use breath in a self-healing and self-regulating way. They have to be responsible in its usage. They must have the ability to integrate the deep-level emotional and paradigm-shifting work. Sometimes, as we suggested, it can engender non-ordinary states of consciousness. Both the client and the practitioner need to be trained in how to maintain and even enhance their self-responsibility when their awareness shifts in a breathwork session. With very little training, this can be translated into their daily lives. Clients must have the physical capacity to be able to engage in techniques that could induce these non-ordinary states of consciousness. Slower than normal breathing techniques involve breath awareness, just being aware of the breath, as I said, and giving feedback to our clients. The circular breathing I did with you in the beginning of today's session is another technique I use quite often to help induce calmness and relaxation and a portable sense of safety that clients take with them. Coherent breathing, taught by HeartMath, mindfulness breathing, benevolently using slower than normal breathing, and even yogic techniques are used by mindfulness and HeartMath practitioners, having in their toolbox to be able to also use the faster than normal breathing techniques gives a complete set of modulation techniques that can bring the right breath to the right circumstance. little mini exercises, and I have many of these on YouTube. We'll take you through 100 connected breaths without pause and re-energize the system in 5 minutes or less. A full breathwork session, as taught in our trainings, may take 30 to 60 minutes as a beginning, a middle, and end, and trains practitioners how to engender in their clients a confidence to be able to use both slower and faster than normal breathing techniques. This actually has been done in yoga for centuries. I would like to encourage people to learn the faster than normal breathing techniques. This first research that was done at a community mental health setting did faster than normal breathing techniques. Holotropic is a faster than normal breathing technique with 11,000 psychiatric patients over a number of years without one incident of inducing any sort of trauma or difficulty. It's clinically documented. We have an association which regulates ethical practices and standards of training, and we have a training center here in Milwaukee, Wisconsin. We are working with clinicians of all sorts, so it's not just psychotherapists or addictions counselors. Dentists learn how to calm their patients with breathing techniques. Physicians, physical therapists, occupational therapists, massage therapists. Everyone has been adapting the breath awareness and breath modulation to get enhanced results with the techniques that they use.
One experience that I just want to share very quickly. Jim had come up. I worked at the Oneida tribe, and Jim had come up, and in cahoots, we helped train an entire staff. And I thought it was ingenious. It took a lot of courage for all of those people to open themselves up and be vulnerable with each other. But wow, it really built some cohesiveness with the therapists. And a really awesome piece that came out of it was that people came together and continued to meet and practice. We even developed a breathwork room where people could have their breathwork sessions. So there was something so valuable and useful in bringing that training to our staff. On a financial level, it was great for the staff because they didn't have to pay for extra meals, lodging. So today, when we're always looking about saving dollars and how to get people trained, this was a wonderful way to bring that in and to give breath work to everybody on the staff.
I also was invited to do training for a staff of a Christian counseling center and community. And here's some written feedback that we got from the director of that center. We found the use of breath work has become a staple on our retreats as well as in our groups. We've just started a part of our practice dedicated to addiction and recovery. And we plan to have breath work and meditation be a central aspect of our overall healing strategy. Several of my people actively use breath work with their clients in individual sessions. We often hold group sessions for breath work on a quarterly basis for the entire practice. It's a favorite. Although not all of my staff regularly practice breath work with their clients, many do. Even those who do not use breath work with their clients are always grateful when we do breath work in our staff meetings, workshops, and retreats. So therapeutic breathwork is a complete toolkit of breathwork techniques for the clinician. We train to seek the right breath for the right healing and growth situations in one's practice. There's no one-size-fits-all technique for every circumstance. As such, we adapt traditional slower than normal breathing for centering, relaxation, and meditative purposes, natural breathing for everyday flow of life, and faster than normal breathing for energy release and breakthrough work and trauma healing and personal growth. We have specialized in the faster than normal techniques about which there is far less written in the literature and research. But familiarity with these techniques is spreading, and we are in the forefront of adapting it and training its use for the healing arts. Now, not every counselor is going to want to incorporate breathwork as an adjunct to his or her counseling practice, nor will every counselor be attracted to use breathwork for her or his own well-being and self-care. This is as it should be in a pluralistic society. But every counselor and every client breathes. The community of breathing is a link that brings us all together. The breathing patterns of a counselor as well as a client tells a great deal about their moment-by-moment state of ease and resourcefulness in their lives as well as in their work. Breath awareness is a viable adjunct to the healing arts, even if formal breath modulation techniques are not employed. The growing field of breathwork is contributing valuable data to the conscious and therapeutic use of this simple and yet powerful tool we all have right under our noses.